and what we're doing. And hi, how are you? I was waiting for you, and now I'm going on the air. So I would like to talk to you in a little bit. Let's make sure we're having trouble getting on Facebook today. So let us see why we're not on right now. And we are not. So I'm going to have to reset here. So I got all ready to go, and look what happened. We're not even able to do it. So give me one more minute, and we
Sounds good, Jim.
Everybody's, you know what they're doing?
What's that?
They're all studying from home online, and they're blocking us out. So
are we on the air right now, Jim?
we are on the radio, and we're on my network. So I think what we're going to do, Doctor, is why don't we go live on my network, and then I'll just post the show. Would that be okay with you?
Sounds good to me.
Yeah, we're on the radio, and we'll go back and do it afterwards because Facebook has been very wonky with us. So why don't we start right now with Dr. Sean Kondamuri. He's with Midwest Interventional Spine Specialists. How you been?
You're doing great, Jim. Fantastic.
So
despite the cold weather and COVID-19 and everything else, things are good.
You know, you brought it up, and we got to hit it. We got up to over 8,000 cases here in Indiana. Luckily, our numbers just came out today, and we're only at about 5,700 cases with 42 new deaths here in the state of Indiana. These numbers come out around, they just came out just a little while ago. We're at some of our highs. California's locking down parts of the state with stay at home. Just give your state of COVID from Dr. Sean Kondamuri. What's going on?
I mean, it is a reality. It's there, and we're all going to be facing this now and probably for a few months, despite the vaccine that's going to be available soon. This is not over, is what I pretty much say. COVID-19 is happening. You know, one of my friends, a family doctor, just told me about his patient who was 53 years old, fairly healthy, and just died from COVID-19. And he was pretty emotionally, he was very affected by it. And he made a big point of saying, you know, he was very annoyed at people who are thinking that this is all just a joke. It's not that serious. It's not until you have somebody that you actually know who gets really sick or dies, because you can't fake getting really sick or dying. It did happen. That's not in somebody's imagination. So when that happens, it's serious. And we do see patients that are getting sick, and some people are dying. And it's not everybody. And a lot of people are going to be just fine, and they might become positive, but they'll be asymptomatic, so it's not a big deal. A lot of our young people might never really see any major illness per se. They'll just be positive. But you have to remember that you might be giving this to somebody else, some loved one or close friend who has some pre-existing medical condition like heart disease or some kind of emphysema or asthma, and then they're at high risk of getting COVID-19 and getting sick from it as opposed to just getting positive. So I think it's really important for all of us to just think about our friends, our neighbors, our community, and others around us, and really care about others. Even though you might be doing just great, there are others around you who may not be.
He is Dr. Sean Kondamuri. Anytime you always want to get in, it's 219-845-1100. Doctor, you brought a bunch of stuff up in that little thing that we were talking, but, you know, we got to backtrack a little bit because, quite frankly, doing this show with you has given me, like, some coping I mean, I know you've got, like, 8 words that you kind of hold everything together with, but if we establish that there is a wellness factor here, then I want to talk about grief, because a lot of people are in the grieving section right now. But remind people on your just general wellness outlook.
You know, I mean, we've talked about this a lot, and it all comes down to if you're healthy and you have a healthy lifestyle, you're less likely to develop medical conditions. And if you do develop a condition, it may not be as sick. You may not become as sick. You know, the whole point of, if we apply this to COVID, the whole point of COVID-19 and wearing masks is this. Masks don't prevent you from getting sick. It doesn't prevent you from, becoming positive, but it reduces the likelihood of things happening. So if you are wearing a mask and you happen to be carrying COVID-19, the virus in you, you're positive, in other words. If you're wearing a mask, it doesn't absolutely eliminate the risk of people who are around you, but it reduces what's called the inoculum. And the inoculum is the amount of genetic viral material that you're delivering to somebody else. So if you think about it, if there's a a certain volume of virus in your cough, and a certain amount of virus in your cough hits somebody else who's 60, 70 years old, they're going to get sick, let's say. If they get hit with 1/2 of that amount of genetic material, 1/2 of that amount of virus in the inoculum, they're less likely to get as sick. Your body can handle and maybe fight off a certain amount of the virus in you. But if you're given a large load, you're less likely to be able to fight that off. So I don't know how I got into that, but
wait a second. Can I back you up? Because
you like that?
We're all watching, the same stuff on television news and on the internet and cable at night times and stuff.
Right.
I don't think I've ever sat through anybody explaining why a mask works and to reduce, what do you call it, the viral load?
The viral load, and the real word we talk about is inoculum.
What does that mean?
Inoculum.
Exactly? Inoculum.
It's sort of like it's sort of the viral load. It's a load, the load of the germ that you're giving somebody. In this case, it's a virus, not a bacteria. So when we talk about masks, there's a lot of controversy, right? There's a lot of people out there who refuse to wear a mask. There's a lot of people out there who do not believe a mask works in any way. And then there's the government, the CDC, telling you we should all wear masks. And, this is obviously a problem because a lot of people are not too happy about being told what to do. So, it's our independence, it's our rights that are at stake here. And we feel like, well, why are we doing this, especially if it doesn't work? And I hate to say it, but there's a recent Danish study that really didn't support the use of masks in some ways. And, it doesn't mean we shouldn't wear masks, but it all gets down to what are we trying to accomplish? We don't expect that a mask is going to prevent you from getting a disease. The reason I wear surgical mask, if I'm in surgery wearing this mask, if I'm wearing this mask in surgery, I'm not wearing it for myself. I'm wearing it so that I don't breathe or cough into that patient's body and get them sick. That's the main thing. That's the main reason we wear a mask, is so that the patient in the operating room, whose body might be open from some kind of surgery, he's not getting infected by the doctor or the nurses because they're wearing a mask. Now, that's good. We're protecting others, but are we protecting ourselves? To a certain extent, we are, and it goes back to the inoculum. So if I throw a huge amount of virus at you, and your body or your lungs only see a small amount, well, you're less likely to have a problem because your body can fight off that small amount.
So, all right. So I'm going to get my mask and I'm going to do this segment with my mask on, and we're going to talk a little bit about it. But we are on the radio talking to Dr. Sean Kondamuri. Now, Doctor, and by the way, Jim, we should make it clear to your audience that I am not an infectious disease specialist. Yes. I am not a COVID-19 specialist. I am an internist. So I did take my board certification in internal medicine. I've trained in that, but my main job is as an interventional spine specialist. I treat low back and neck pain. I treat chronic pain of all kinds of reasons. I'm not an infectious disease or COVID specialist. So I'm just telling you what I know through the filter of being a doctor and being an internist. So I can maybe filter it better than somebody else. That's all I'm saying. And he's on, you're on Calumet Avenue, right off Calumet Avenue, right? Yes. And so that's why you hear the siren in the background all day long. Yes, I'm right in front of the hospital. I can see the hospital over there. All right. So, Doctor, let's break this down. It sounds as if, to some extent, for the layperson, that there is like what do they call it? Like critical mass. That if you're under that, your body will filter it out and the virus will die and it won't replicate and you won't get a full-blown case of this thing. But if it gets over a certain level, like say somebody coughs without a mask and it gets into your lungs, so that now you're over the critical mass, that is what you're trying to avoid by wearing a mask, correct? That's exactly right, Jim. That's so well put. And the point is, everybody's critical mass is different. So a person who has emphysema, somebody who's smoked for maybe 20 or 30 years and they have emphysema, chronic lung changes, for them that critical mass is very small. It doesn't take much for them to get sick. But you take a super healthy guy who might also be around the same age group, and it might take more for him to get sick, but he's still at risk if he's older. We're talking to Dr. Sean Kondamuri, and quite frankly, you have cleared up quite a bit on the mask situation. What did the Danish study? I know you were hesitating to talk about it, but you got to give the other side. I mean, I know the answer to this, so I'm being a lawyer here and asking a question. But the Danish study has kind of given one side of the argument a lot of fodder.
Yes. So let's talk about the Danish study. So in Denmark, they did a study. They studied like 6,000 people. And they told these 6,000 people, we're going to do this mask study. Half the people were told to wear a mask, and they gave them a video to watch on how to properly wear a mask. And the other half, they said, do whatever you want. If you want to wear a mask, you can, but we're not going to really insist that you wear a mask. You do whatever you feel comfortable doing. But the other 3,000 people were supposed to wear a mask all the time. Now, the infection rate that they had in Denmark was right around 2%. So about 2% of people were becoming positive with COVID-19. So then the researchers thought, well, if we put a mask on this half of the population, these 3,000 people, then what's going to happen is we're going to find out that we expect that their chance of getting positive from COVID-19 is going to cut in half. We expect it'll be 50% reduction in COVID-19. So that's what they're hoping for. But what happened is there was not much difference. It was down, the infection rate was about 1.8 in the people who wore a mask, and it was about 2.1 in the people who did not wear a mask. So it's still higher, about 16% higher in the people who did not wear a mask than the people who wore a mask. Now, it's almost the same. So the controversy is, well, then why are we wearing a mask? So the point again is they didn't study how many people were actually getting the disease around them. They're only testing it for the individual wearing the mask. They wanted to see if the individual wearing the mask was going to be safer or not the people around him. They never studied the people around him. So what it seems to suggest is that the people wearing the mask are not significantly safer than the guys not wearing the mask regularly. Now, the problems with the study, there are problems.
All right, we're on the radio, so I got to introduce, people are driving around. We're talking to Dr. Sean Kondamuri, and he's with Midwest Interventional Spine Specialist. We're going to talk a little spine here in a second, but doctor is also an internist, and we'll take my questions on COVID as just like everybody else. All right, now go on about the Danish study.
Yeah, so I want to just make it very clear that the Danish study did not test whether or not we're protecting the other person. We're testing whether or not the person wearing the mask has an increased risk of getting COVID-19. And it appears that there's not a significant improvement in safety if you wear the mask for yourself, for the wearer of the mask, not the other person. But what I think the thing that is important to know with the Danish study is that what it tells you is that we have to follow the 3 W's. 3 W's for COVID-19. Have you heard this, Jim?
No.
The 3 W, I like this, I like to simplify everything. So this is easy. So stuff you already know. 1 W is wear a mask. The second W is wash your hands. And the third W is watch your distance. All right. So wear a mask, wash your hands, watch your distance. So what the study really tells me is that people should not feel invincible because they're wearing a mask. So if you wear a mask, you shouldn't think, oh God, I'm safe. I don't have to worry at all. I can now hang out with people a foot away from them. I can be in a crowded room with 20 people, wear my mask, and I'm 100% safe. What the study tells us is that you are not safe. You still have to maintain social distance. You have to wash your hands before you touch your face, and you should still wear a mask. That make sense?
www.drshawnKondamuri.com. No, we're talking to Dr. Kondamuri. Right. So, Doctor, I want to circle back on something here. You started out by saying that, a lot of people are grieving right now. I think we've had 270,000 people die in America, and they're projecting 400,000. It's just an immense amount of people to fill up Soldier Field 4 times, and then everybody's dead. I mean, that's just, you can't even think about how many people have died. But like your friend that had somebody die, my stepson, his dad died, and I've had other people in the family die. From a physical standpoint, you're suggesting that people, exercise, eat less, try to stay active, try to stay positive, try to, engage in love. But when you're grieving, it's really hard to do any of that. What can you say about that?
I mean, all you can say is you have to try your best, because obviously if you're grieving over, are you talking about grieving about somebody
Yeah,
close to you?
I mean, there's a lot of people grieving right now because somebody has died close to them in one way or another.
Well, I mean, this is not really medicine I'm talking about now, but I mean, that's just, you have to turn to something. You have to turn to some faith. Hopefully if you have some belief in God, I mean, you believe, you turn to your spirituality, you turn to whatever is within you that you believe in that's going to help you get through this. You have to do that.
Doctor,
That's just like anything.
I'm looking at it.
COVID.
Yeah, I mean, I just wanted to hear you address it because I know that it's hard on the morning show. It really is hard. I mean, it takes a lot of calls and a lot of texts and, a lot of messages throughout the day. I just got one as we were going on the air here that looks like somebody passed, the older gentleman. But I'm looking at the map right now, and I can't really show it right now because I'm on the computer where I would show it. But Lake County is in the red. And we are surrounded by almost everybody not in the red. We're like at the highest level you can be. Now, there's some rural counties that are not in the red in Indiana. In your mind, doctor, I'm just asking just in a general, hey, we're sitting on a park bench talking. Why are we so high and why are we remaining so high?
It's hard to say, Jim. I think, there's so many factors there's so many factors you could use to explain why some areas are having a surge and some are not. And it might be having to do with our density. We're clearly in Indiana, I think outside of Indianapolis, we're probably one of the most dense areas, densely populated.
Yeah, I guess they said anywhere north of, like, say, the Borman is maybe the densest part of Indiana, even within Indianapolis, other than downtown. It's kind of crazy. Exactly. You don't realize how close people are,
We're packed. And yeah, it's very, very dense, the population. Similar to Chicago, right? And we see a lot of the same we seem to be following Chicago in many ways. So the density is one thing. And also, I just don't know how strict our population is in following these rules. These, not rules, but suggestions. And I don't want to criticize anyone, but, I don't know if everyone is as strict as they should be.
Oh, yeah. That's one of the main talking points on my shows is people arguing against masks. Basically, the argument is COVID real or not? And
yeah, I mean,
people are on both sides, and they have good arguments. 270,000 dead people is kind of hard to argue away, though.
Hard to argue about that. I mean, there are people right now, Jim, who still think the world is flat. There are people who think that we didn't land on the moon. Yeah. Right? There's always a conspiracy theory for everything, and it seems like there's way more conspiracy theories right now regarding COVID-19 than there should be. I mean, you would think by now most people know somebody who has either been in the hospital or has died. By now we should I would imagine most of America has some close connection as opposed to just seeing it on TV. So I would expect that we should be a little bit more strict about following certain guidelines.
He is Dr. Sean Kondamuri of Midwest Interventional Spine Specialist. We're live on the radio. And if you would like to call him right now, is a good time, 219-845-1100. Doctor, let's shift off of that. And you mentioned something. Every time you call in or we do this show, most of the times we deal with lower back pain. And part of it is that I'm a golfer and I'm getting, I get older and I've got, most of my buddies have lower back pain of one sort or another. But every once in a while that pain is a little bit further on up. And, either between the shoulder blades or even all the way up at like the brainstem or the top of the neck. What are some of the major causes in that area?
The number one cause is going to be just muscular, Jim. Muscular.
Meaning?
Muscles that are getting tight, muscles that haven't been stretched, muscles that are always getting stressed. If you're stressed, that area of the upper back and neck area, those muscles are going to be under tension. Our constant use of computers nowadays, our constant use of cell phones, constantly looking at things on a screen puts a lot of tension on those muscles in the back of your neck. And those muscles in the back of the neck, in your upper back and the back of your neck are muscles that are very delicate. And if you're not constantly exercising them or keeping them loose, you will have pain. And if that goes on month after month, year after year, it becomes very chronic and very hard to treat. Then if you add on to that, as we get older and you've got degenerative arthritis changes in your spine, that only adds to the whole problem.
So I do know someone. I have a close relative that she says that she's hunched over her computer now with Zoom all the time, and
Yes.
working from home, and has never really had like the upper neck pain and the tension. And I mean, I don't know what to do. I mean, I'm moving. You see me try to move, and people say, "Well, why you're moving so much during the show?" I want to move. I want to keep my body moving and limber, and I have a lot of room here. It's all designed for movement. So I'm not doing what I'm doing right now. I'm kind of with you looking at the computer, but this is about the only time during the day. But I see people that are doing 7, 8 hours of this at a time. What can they do to stop that upper neck pain?
Well, I think they should do a lot of what you just said. Get up and move around. That's really, really important. You need to get up and move around. If you're sitting in a position, because everybody now is working from home, and they've got meetings all day long. They go on for 6 or 8 hours sometimes, and they're just staring at a screen. And if you're just sitting there staring at a screen and eating your lunch and having your coffee in front of that screen, and you're not even moving, you're going to have difficulties. You need to get up and move around. You need to stretch. You can take your calls while standing and while walking around with AirPods or something in your ears, or just talk to your computer will even pick up your sound if you're 10 feet away. It'll pick up your voice. You can be moving around. That's the biggest thing. And then you just really have to exercise regularly. Despite, the sedentary lifestyles we have nowadays, it's all the more important that we be exercising on a regular basis.
One of the minor suggestions, if I might offer one here, is when I went to a wireless microphone, and they are about $400 on Rode, RODE, to buy a sending piece on your belt and then a receiving piece that you just put in the side of your computer, you would be surprised how much more movement that little bit has given me. I used to be tied to a headset, and I was just looking at the screen, or I was just talking hours on end. And now that I've been able to get up and move around, there's nobody here, I'm doing it by myself, it has made all the difference in my physical health.
Even AirPods are the same thing. Those are, AirPods are the same sort of thing. You can use those, and you don't have to get the Apple version, you get a cheaper version. But either way, that allows you to have some mobility, and you're connected to your computer. You can speak and be heard very clearly.
Doctor, you seeing any specific types of neck and spine injuries that are becoming more prevalent other than, the tightness and stuff during COVID right now, or is it pretty much the same stuff?
Very much the same thing, but we see a lot more exacerbation of pre-existing arthritis changes. So if you have pre-existing arthritis in your joints or arthritis in your discs, then those pre-existing changes those pre-existing problems are going to get amplified, and you're going to have more flare-ups. So we see a lot of that, which requires treatment very often. Many times it's just physical therapy, but oftentimes physical therapy isn't enough. We have to get involved and do certain procedures on patients to get them better.
And people are able to do physical therapy right now, correct?
For the most part, that could change any day now, but I'm sending people to physical therapy right now. I did this morning. So physical therapists are open. They're taking lots of precautions to keep you healthy. But you have to remember, and this goes again back to COVID, we have to remember that perhaps 40% of those people who are carrying the COVID virus in their body, who are actually positive, don't even know it.
40%?
Their temperature is going to be normal. Could be 40%.
Really?
At any given time.
That seems so high, man.
So high. It's ridiculously high. And we all, anywhere you go, like even in my own office, we're checking temperatures on people's foreheads. That misses most everyone. I can't tell you how many normal temperatures I see if I look at my sheet where they track all the temperatures. Every single day, all the temperatures are normal. Actually, they're lower than normal. And I'm pretty sure some of them are perhaps carrying COVID-19. So much so that if I take a patient to the hospital for a procedure, they are asking everybody to get a COVID test, even if you're asymptomatic. And we are finding people who are positive. And every time I'm there, I might have 1 or 2 patients canceled because they're COVID positive. And they had no symptoms. They had no idea that they were positive. So I don't know if it's 40%, but some significant number are positive and don't even know it.
I've heard that too, but even without the symptoms, a lot of people still aren't tasting their food. That seems to be kind of,
Yeah.
I mean, they can't taste or smell. I had a guy tell me last week that he's like, man, if my house was on fire, I would have no idea unless I was looking at the fire because I can't smell anything.
Exactly.
Hey,
That could be a good thing. You also don't smell the bad smells too, so that's good.
he's always looking on the bright side of things, isn't he? Because he's Dr. Sean Kondamuri. Doctor, on a side note, I interview Dr. Shandana Vavilala on a regular basis.
Yep.
And
She's the Board of Health.
Board of Health, man. And, she just has the toughest decisions to make. But one of the questions I asked her, and I didn't know the answer to this, but I do now. I said, well, she was talking on and on about, her strong suggestion that we don't play contact sports right now. And finally I said, well, do you have the power to cancel all those? And she says, yeah, I do. But in terms of contact sports during the pandemic, I'm just wondering what your view on it is.
Well, so this is the same question. It's a bigger question, Jim. So the scientists and the doctors can tell you what's right from a medical or scientific point of view. Okay, we can tell you what the science says, but the science doesn't make policy. A scientist should not be making policy. Policy is determined by the politicians, by the leaders, by different people in your community or organization. And the reason I mention that is because it's not always a question of what's completely, absolutely right from a scientific point of view. There are many other considerations, and contact sports is just like school. I mean, I want our schools open. If schools are not open, if our kids stay at home for another school year, like next semester, let's say next semester they're at home for some time, for a few months. But if this extends beyond that, we're already seeing children are having some difficulties. You're almost having a certain percentage of the population is going to almost lose this school year of education. That can't be good. We can't have that. There are ways to make it safe. And if we take these precautions, we should be taking these precautions. Dr. Vavilala may say, let's just say she said all schools should be shut down. I mean, every community is a little different. You can't apply the same rule to every community in Lake County or every school system in Lake County. It has to be made at a school level, at a local level, and they should take into consideration what's happening in their town and make that decision. And every school, there's a reason why every school system has a different approach. Some of them have like an A-B schedule. Some of them are completely closed. Some of them are, you go alternate days, all kinds of stuff is going on like that all over the country. It's because every community has a different set of problems and they're addressing their problems. Hopefully with the goal of trying to keep our children in school and educated. If not in school, at least virtually, but we hope, we know that kids need to socialize. There are kids who are sitting alone in their homes every day, and that's not good for them.
I don't think that, I think you pretty much sum that whole argument and answer up in a very short period there, and I think that's a strong point to end, Doctor. A lot of this stuff is difficult, and I mean, it's even hard to talk about, but you're able to analyze it so succinctly. I appreciate that.
Thank you, Jim.
Maybe one day we're going to be doing this, and it's going to be sunny out, and 80% of the people have been vaccinated, and you and I are going to go for a bike ride. We're going to put our arm around each other at the end of the bike ride as like a hug. And it's like something to dream about, right? We
can ride right now, Jim. It's okay. Yes. Riding, it's all right. It's the wind's blowing all that virus behind us. No one's going to feel it. We can riding, outdoor activities are still fairly safe.
All right. Leave it right there. Doc, thanks a lot. Appreciate it.
Thanks, Jim.
Man, thanks a lot. He breaks it down. I enjoy talking to Dr. Sean Kondamuri, Midwest Intervention.